The state health department is getting a massive number of complaints alleging maltreatment of vulnerable adults at care facilities. So many complaints that the vast majority are not investigated on site.
When one family couldn't get the help they needed, they came to the Fox 9 investigators, and tonight Jeff Valiant has their disturbing story. We want to caution you first. Some of the images are graphic.
You kids have a good time.
She was just a few months shy of 100, and despite the onset of dementia, still showed a sparkle of wit at the sight of the logo on her daughter's iPhone.
Somebody took a bite out of the apple, though.
You're looking at my phone, aren't you?
Yeah. I thought that they were saving that for me.
But this was before that awful day.
She sure didn't have to go through this the last days of her life.
The case of Mary Whitman.
Oh my God.
Is shocking even to experts who study maltreatment.
There's a lot of red flags here.
And it raises serious questions about how the state of Minnesota is investigating cases of suspected neglect.
And I think they've lost sight that these are human beings.
Mary Whitman had surgery at St. Cloud Hospital to repair a fractured hip. A few days later, she was strapped to a gurney and loaded into a medical transport van for a 36-mile drive back to her nursing home. It was just her and the driver in the care cab. When they arrived at Coronis Manor in Paynesville, Mary was screaming and kicking and covered in blood.
It looked like a wild animal had gotten a hold of her hands.
Kay Bomstead took these pictures of her mom's injuries. The driver, according to medical records, said Mary received those skin tears from pulling her arms out from underneath the safety belts. Apparently, the combination of her dementia, the anesthesia from surgery, and being with a stranger sent her into a panic that lasted the entire ride and continued at the nursing home.
And said, "Mom, it's me, calm down." And she'd look at me and she'd just grab my hand and bite, and she was a mess.
She never did recover from the ordeal.
We're kind of connecting a little bit again, aren't we, Mom? Good job.
She passed away 2 weeks later.
Had I been notified from the hospital when she was going to be released, I'd have been there.
Bomstead says she asked for and expected a heads up when her mom was leaving the hospital. Medical records show Mary was in a terribly agitated condition on the day of her release. Even more reason, says Bomstead, to have been notified so she could have been at her mother's side for the ride back to the nursing home.
I can see her becoming probably fearful. Where is Kay? And where am I going?
2 days after her mother's traumatic transport, Bomstead spoke with the driver. She says he told her that a hospital nurse had warned him the patient he was picking up might be trouble.
She said, "I hope, sir, you have rubber gloves because you're going to get bit, pinched. We don't want to have any blood on you. It's going to be a nasty ride."
The driver confirmed to the Fox 9 investigators that's what he told Bomstead. He declined an on-camera interview or to provide further details of what happened. In medical records, he's quoted as saying he had to pull over several times because Mary ripped off all the safety buckles. So a ride that would typically take about 45 minutes was actually closer to 2 hours.
So you've put somebody who is vulnerable and at risk in a situation in which she's at even greater risk. That, to me, is really unconscionable. That should never have happened.
Dr. Nancy Fitzsimmons is a professor of social work at Minnesota-St. Mankato. She was stunned to hear the state health department decided not to do an on-site investigation of the Whitman case.
If this is supposed to be our protection system, then it should actually protect people. And this clearly didn't protect this woman.
No state regulator has met face-to-face with hospital staff to question why they did what they did, or interviewed the driver and tried to confirm the accuracy of his story.
At this point, I think they've gotten worse than they've ever been.
Mark Kozorotsky is an attorney who specializes in elder abuse cases. He's not surprised state investigators passed on the Whitman case.
They claim they're understaffed, but if we hand them the evidence and they still don't want to investigate or reopen a claim, what it tells me is we've got a culture there that just really doesn't care.
First of all, we do care. and we take our job very seriously.
The health department has been deluged with more than 24,000 maltreatment allegations in the past year. Of those, only about 10% led to an investigation on site.
Are you happy with that number?
The number, 10%, is obviously not the optimal number. That's not where we want to be.
Those cases that do get investigated are taking on average about 6 months to complete. By law, they're supposed to be done in 60 days. The department hopes to get funding from the legislature to double its current staff of 24 investigators.
We're hoping to investigate them faster.
Which means they'll continue to triage complaints and limit on-site investigations to cases where, quote, serious harm occurred. Mary Whitman's bloody, panic-stricken transport didn't rise to that level. The state reviewed the records and determined there were no violations of state or federal regulations.
And you can't do this through telephone calls or through reviewing paper documents.
Centricare Health, which operates the St. Cloud Hospital and Coronis Manor Nursing Home, declined our request for an interview, but in a statement said, "We are deeply troubled by what unfolded after the patient left our care. We immediately reviewed the situation with staff, the patient's family, and the company that transferred the patient. We apologize to the patient's family as this experience is not acceptable."
I'm not asking for anything monetary.
The hospital did acknowledge in its written apology to Bomstead that a second person could have been provided to care for her mom during the ride. But Bomstead wants more than a piece of paper. She wants to meet in person with the staffers who handled her mom's release from the hospital.
I wanted them to say that they were sorry and just acknowledge to me the mistakes that they made, and I wanted to see the horror on their faces when they saw the way my mom looked when she came back.
This family just wants some answers, but without a state investigation, they will never truly get a full understanding of what happened to Mary Whitman. And critics say this case is another example of a system that isn't working.
Jeff, you mentioned more than 20,000 maltreatment allegations in the past year. So what's the reason for the spike?
Well, the state really doesn't know. As the population ages, you have more people needing care, so there's more demand for help. Is it a lack of good workers, a training issue? Those are all good questions, but no clear answers.
Somebody needs to step up and do the right thing here. That's just awful seeing those photos.
Really
and
tough.
What happened to her.
Really tough.
All right. Thanks, Jeff.